Hello, Andrew Collishaw, homeopath and naturopath, and I hope you're going well with your treatment, your medicine. You may have finished your treatment by now, or you may still be continuing on with it. And I just wanted to spend just a few minutes to explain something really important when you're having naturopathic or homeopathic treatment, because it is very different, obviously, but also the approach is very different to standard Western medicine or allopathic medicine. So we need to have an understanding of that, so you know what's going on, so that you can appreciate why you've been given a certain medicine or medicines and what we expect to happen. Now, it's really important to understand when you're treating a condition, you've got to realize, is it an acute condition or a chronic condition? And therefore, the actual approach, the treatment, the progression of healing is going to be very different for both of those situations. And also, we need to be able to take a step back and look a little bit deeper in both of those situations. So, for example, if you have some skin disease, or if, for example, you have IBS, or you have migraines or depression, if you're suffering from some of these conditions, then it makes sense, doesn't it, that it's probably going to take some time to actually get to the bottom of what's going on and to be able to address the causal factors. Now, what this means practically is that it's not going to just be one medicine necessarily that helps you. We may need to use a few different medicines over a period of time. You see, it's very easy to be looking for a quick fix. And that's appropriate in certain circumstances, absolutely. If, for example, you have hay fever and it's flared up, usually you would just come for one appointment, we give you one medicine or a couple of medicines, and off you go, and that will settle the symptoms right down for you, usually very quickly. Now, if you're not treating something as straightforward as hay fever, or if you're actually wanting to look at the underlying issues, the immunological issues that are contributing to the hay fever, then that's a different story. We have to look broadly at what's going on with your health, and there may or may not be other obvious things that are happening there, but we need to take that into account so that we can be treating underlying issues naturopathically or homeopathically. And this requires time, a bit of patience, and it also requires a tenacity, because you need to be able to stick with treatment if you're going to get the results that you're looking for. Now, I just mentioned IBS, irritable bowel syndrome, and in these sorts of cases what we need to be doing is addressing the acute, the here and now, which might be pain, abdominal pain, diarrhea, those sorts of symptoms. And we also then need to be treating the underlying issues. Now, when we're treating both of those, we do need to take into account the reasons why the digestive system has become dysfunctional. Now, it hasn't happened just overnight, obviously. It's probably been happening for many months, possibly years, because with the way we eat, our lifestyle, the various stresses that we have to cope with from day to day, various medications that we may have had, the approach that we've taken to illness and disease in the past, all these factors and many more really contribute to the health and integrity of the digestive system. So if we're going to start to repair some of that, if we're going to start to enable the cells of the digestive tract to be secreting mucus and digestive enzymes and the organs, especially the pancreas, for example, to be digesting enzymes into the intestine, we need to be building up the resilience of these cells so that they can function correctly. And that can take time. You can imagine someone who's had bowel problems, constipation, diarrhea, on and off over many years. That's going to have a big impact on the mechanisms of the digestive system and can very well be one of the contributors to having a disease or IBS down the track. So it's going to take time to use medicine and other lifestyle changes, dietary changes in this case, to address the underlying issues. And of course this applies to many other conditions as well, okay? And it's really important that you have a good look at what's happening with you and your health. What are you needing treatment for? And what's been happening with your health previously? Now, there are some of you who have just come for an acute treatment, which means you're hay fever, or perhaps you've had a migraine and we've given you medicine and it's settled down, it's gone away, and you use that if you get the migraine. You take the medicine and it helps you. Now that's fantastic and that's really good. That's what we're here for. And I would suggest to you that you just have a think about, okay, are you happy with that? And maybe the answer to that is yes. You've got medicine, you've got a routine, you've got some supplements, herbal medicines that are going to address a particular problem, and you're happy with that. And that's fine. The next step, if you want, is to be thinking, okay, well, why do I have these weaknesses? Why do I have this issue with my skin? Why do I have a disposition to getting lung infections? Or not even that severe. Why do I get a cold every single year? There are underlying reasons for that. It could be, for example, generally that your immune system is just not functioning properly. Now, everyone pretty much can cope with a cold once a year, but what happens year after year, time after time? It's a weakness in your immune system. And as you know, your immunity is such an integral part of our being, and we need to be nurturing and nourishing that as much as possible. So if you've come in for an acute treatment and you've got better from that, then I'd be looking a little deeper. Are there other health concerns that I can address, or health issues that can be addressed, areas that can be strengthened and fortified to improve your health, to help you to be feeling better, more energetic, and to stop or to minimise the onset of these other conditions. So there are different ways that we can approach looking after your health and your healing. All right, so I've said a lot today, but it's very interesting, and we can treat you at various sorts of levels depending on what's going on and depending on what your particular needs are. All right, I hope you found this interesting, and if you've got any questions, I would love to hear from you. Give me a call. More than happy to chat to you about what I've said today, because it is really important, because I've said this before, the decisions you make about your health now can very well have a profound impact on your health in the near future and way down the track in years to come as well. All right, so I'll look forward to talking with you soon, and we'll see you then. Bye for now.